to this panel. We really appreciate you joining us. We're going to be having a really important discussion this evening, so this is really great that you're here. Just a little bit of background. So we are the STEM and Health Equity Advocates, or SHEA, at Yale. And this is the first in a series of workshops that we've been having this year to foster dialogue about the social determinants of health. Today's panel is titled ICE and its Health Impacts: How Immigration Enforcement and Policies Influence the Health of Immigrants and of Asylum Seekers. So our event for today is going to have two main sections. We're going to start with guided questions to kind of provide some background into our topic and into the research of our panelists. And then after that, we're going to have a Q&A session where we're going to seek some questions from you guys. And so if you have any questions throughout the talk, wait till the Q&A session and unmute yourself to ask your question, or you could submit them in the Zoom chat, either privately or to everyone. It doesn't really matter. I just need to see them so that I can pose the question if you don't want to unmute yourself. So today we're going to be learning from two wonderful scholars, Dr. Nolan Kline and Dr. William Lopez. So Dr. Kline is a medical anthropologist and assistant professor of anthropology at Rollins College, where he also serves as the co-coordinator of the Global Health Program. His work is broadly focused on issues of health equity and the social determinants of health, and more specifically on the topics of immigrant policing and health, LGBTQ plus Latinx legal mobilization, and immigration and health policy. And then our second panelist, Dr. Lopez, is a clinical assistant professor at the University of Michigan School of Public Health and the faculty director of public scholarship at the National Center for Institutional Diversity. His work is currently focused on the impact of immigration enforcement on the health service utilization of mixed status communities and the response of such communities to immigration work raids. So we are really excited to have them both with us today. We're going to have to take a little break for a little bit to wait for Dr. Lopez, but we will get started right away when he joins us.
Hey, can you hear me?
Yes, great, welcome. All right, I did your introduction. If there's anything you want to say to introduce yourself a little bit more, I gave a little background on your research, but otherwise we can get started with the questions.
Sure. Well, thank you so much for having me, and I sincerely apologize for the error on my end logging in. I'll only say I appreciate all the work you've done to organize the panel, and I'm looking forward to speaking briefly. As she said, my name is Dr. William Lopez. I'm a clinical assistant professor in the School of Public Health and teach on the social determinants of health and health impacts of immigration enforcement and policing. I'm the author of Separated: Family and Community in the Aftermath of an Immigration Raid. Happy to be here today. Thanks.
All right, that sounds great. Okay, so we can start with our first guided question. So to begin, I would like to frame our discussion with some historical context. So my question is, what is the historical basis for our current immigration crisis? What are the roots of our nation's issues with immigration and with over-policing of marginalized people? And how are these issues historically intertwined? So you guys can take whatever elements of that question you want to take. I know it was a lot, but whoever would like to start can go first.
Sure, I'm happy to, you want me to go, Nolan?
Go for it.
Sure. Yeah, so it was a big question, right? So when we're thinking about immigration and we're thinking about policing, and largely often we see those as two different systems, the policing system and the immigration enforcement system. And to some extent they are, but I think as we'll talk about in the panel, many times they're focusing on the same people, right? So there's undocumented folks who are Black, there's folks who are profiled by the police who are Latino. So both of these systems are shaping their lives, shaping lives. And I'll just briefly talk about the history of policing. Folks often forget that for centuries, the police force was used to enforce slavery, right? So for centuries, they literally saw a Black person, in this case Africans, out of place, and they were breaking the law, because at that time they were breaking the law. And after this, police were used to enforce Jim Crow segregation, right? So we see even for decades after that, when a Black person was not where that person was, quote, supposed to be according to law, that Black skin was seen as a sign of law breaking, right? So for centuries, police have done this and have seen that. So if we fast forward to today, lots of what we're seeing is just this is the historic remnants of being trained in this particular way, right? And when we think about any organization working to dismantle something that's been organizational practice for even a few years takes time, let alone for this many years. So I'll leave it at that. And if you have anything else to add, Dr. Kline.
Sure. Well, and thanks so much for really tying in what it has a deep historical foundation in the United States, right? So when we think about the history of policing in the United States, as you said, there are these deep roots in white supremacy, particularly in the US South, where we see that modern day policing directly arrives out of slave patrols and policing Black people. And to think about how this legacy of white supremacy has informed immigration policy, it's also worth then noting that contemporary immigration policy also arrives out of this historical fixation on controlling race in the United States. So early 20th century immigration laws in the US were very much about determining whiteness and protecting whiteness, and conflating health, race, and who is considered appropriate to be let into the United States. So in recent years, as we sort of take that historical foundation of white supremacy that has informed contemporary policing and think about it in terms of immigration enforcement, in recent years, what we've seen is this growing trend to involve local law enforcement and policing immigrants through both local and state laws. And I'm thinking in particular of two federal programs that, for me, deserve and demand a great deal of attention. So that's Section 287G of the Immigration and Nationality Act and the Secure Communities Program. So under the 287G program, local law enforcement officers are essentially deputized as federal immigration agents. And through secure communities, if a person is arrested, they have their fingerprints taken. So, none of you are on screen, but if you want, raise your hand who's been arrested. If you have any experience with being arrested, then when you are arrested, you're taken to a jail and your fingerprints are taken. Through the Secure Communities Program, those fingerprints are then sent through federal databases to determine any kind of a status match, to determine someone's immigration status, or no match at all. And if there's no match, or if there is a match, identifying those fingerprints with someone who's an immigrant, ICE has 48 hours to come and do essentially a status check and start the deportation process. At the state level, then we see how some of this is sort of written or codified into law that allows for racial profiling through certain statutes that allow local police officers to engage in racial profiling to assess someone's immigration status and stop, detain, and begin the deportation process. So all of this together builds on this history, as Dr. Lopez mentioned, of white supremacy and racialized policing. And so in many ways, what we see right now is nothing particularly new. But what we can start to begin to reveal are some of these hidden health-related consequences that this racialized policing regime has on individuals and communities.
Yeah, thank you for those answers. As Dr. Kline, as you kind of transition into my next question, which is, what are the social consequences, so both on an individual and a community level, of immigration enforcement and our policing institutions in this nation?
Sure, I can start again. Another big question. I could definitely talk about each of these for hours. But one of the things I'll start with what I did in my work, and what I looked at was the impacts of one immigration raid, right? And so for all intents and purposes, this was a big immigration raid for our community, right? I live in a decent sized county, Washtenaw County, but it's not like LA or my hometown of San Antonio. And in this raid, about a dozen people were arrested, about half a dozen were ultimately deported. But in interviewing folks who were arrested, who were deported, and to those connected to them, I described the impacts as individuals, families, and communities, right? So these enforcement events, and the raid that I looked at was a no-knock warrants raid, so the same type for which Breonna Taylor was killed. They have many effects, and I'll just say a few of them. One is that these communities trust government officials less, understandably, because they're the ones kicking in their doors. And when you trust government officials less, you extend that to hospitals, to clinics, and even to researchers, right, and to physicians. So we see one of the impacts of violent law enforcement is also severing these connections with the people who are supposed to provide health to these communities, healthcare to these communities. The second is that it definitely changes the way you're able to move about your community. So Dr. Kline mentioned racial profiling, right? And this is what I saw as well, is that there was one individual who was to be arrested, but everybody who drove away who looked like him, who resembled him, was also arrested, right? And what does it mean to look like a guilty individual? Usually it's gender and it's skin color, right? So this is what we see in the Latino community. Often it's also what we will say are signs of being working class, right? So we know one of my good friends was arrested, and we can almost guarantee it was because he had a truck and there was painting equipment in the back, right? We've also seen arrests of folks with landscaping equipment because there's this race and class and gender intersection. And I'll leave it just to wrap this point up. When you look a particular way and you're worried about being racially profiled, you don't use the roads, the sidewalks in your community. When you don't do that, you're not going to church, to the grocery store, to the gym, to the farmer's market, to all these places we know that we need to keep us healthy. So I would say policing and violent acts of immigration law enforcement sever our relationships with our healthcare providers, but also our own use of public space.
Yeah, absolutely. I just want to echo that, Snaps. Right? The very insidious consequences of this kind of enforcement really can't be understated, right? The way that this kind of racially driven immigration enforcement regime results in widespread distrust has far-reaching consequences for individuals and the communities in which they live. And you know, one of the things I so love about your work, Bill, is that you point out how even these single moments, these single traumatic moments like raids, can have enormous consequences. And to pick up on some of your examples, I'm reminded of how, for example, racialized policing in my own work results in widespread fear and avoidance of seeking certain health services in certain contexts that ultimately creates what I call a shadow medical system, or this hidden medical system where some undocumented folks feel might be safer from the threat of deportation or detection from authorities, but is ultimately characterized by substandard care and hyper exploitation, both economic exploitation and the risk of not getting the kind of care that you actually need. It also results in increased risk for interpersonal violence, as someone in a relationship that's characterized by abuse might not feel comfortable reporting that abuse to authorities out of fear of having their own immigration status discovered. And I'm reminded of times from my own fieldwork in Atlanta where I looked at this immigrant policing regime and its health-related consequences, when I would hear from people that were in abusive relationships that they didn't want to call police because they heard a story or a rumor about a friend who did call the cops, and then when the police showed up, their friend got deported, and the person who was responsible or engaging in that abuse didn't end up facing any kinds of consequences. I'm also reminded of some of these other larger system-related consequences that affect our own communities. So I'm thinking in particular of this example that I talk about in my book, where you know, there are health facilities that would treat undocumented patients, but had a large decline in the number of patients that were coming to see them out of fear of those patients encountering law enforcement. So then those clinics had to start adopting these new practices that they never had to do before in order to stay open. I'm also reminded how certain public hospitals like Grady Memorial in Atlanta, the public safety net hospital, ends up having, well, long-term consequences that affect all of our health, right? So we start seeing some consequences that ripple out into all communities and not just immigrant communities. And I'll wrap this up quickly, but this point that you make, Bill, about you know, the ways that vehicles themselves become associated with a particular socioeconomic position, racial marker, and immigration status are so important. And I've started seeing this in Florida, in Central Florida, where police are targeting white work vans under the assumption that these are people working in the construction industry and making assumptions about their immigration status. So now we have material consequences of immigration enforcement, where a white van becomes a metonym for illegality, right? So this thing becomes a representation of a status, an immigration status, that then results in a kind of enforcement effort.
Yeah, and Alma, can I add to that? Sure. I think Nolan, you brought up a good point about folks being scared to call the police, and a lot of what I appreciate about your work and what I try to do in mine, it's not only undocumented folks who are worried about calling the police. So if you are in a house and you know someone's undocumented, maybe your husband, maybe a partner, or maybe just a cousin, maybe just someone in the house, then you're also not going to call the police, right? So it can be full of folks who are citizens, but because of the connection to one person, others are going to stop using those services. And that doesn't, I continue to try to push folks to think about the parallels between undocumented status and other statuses we create in our countries, such as felony status, or even status or label as a potential drug user, right? So there's still these same distrust of law enforcement when you don't know the identity, whether it's citizenship identity, felony status, of other people in the apartment, in the space with you. And Nolan and I also, we push from this idea of mixed status family to mixed status community, right? Which is a community composed of mixed status families or folks of a variety of immigration statuses. And it's not hard to, to extend from there that the way being in a mixed status family shapes your family is also the way it shapes a community. We are worried about calling the police or engaging with these systems if the people that we know, even down the street, we don't know about their immigration status.
Yeah, thank you both so much. Those are great answers. I think we can transition. You both talked a little bit about, actually a lot about the broad medical consequences of immigration enforcement. So I'm wondering if we could contextualize this, I guess, in the current pandemic and talk about some of the consequences that we've been seeing right now.
Sure, Nolan, you want to start this one?
Sure. Well, I'm actually thinking of the piece that we just co-authored, right? That is hopefully on its way out soon.
Someday.
Someday, right? So one of the things that immediately comes to mind for me, and this is partly because of this piece that we have that will hopefully see the light of day in AJPH, the American Journal of Public Health. I'm thinking in particular of detention facilities and the ways in which detention facilities are designed, frankly, to be in humane spaces and to maximize control and visibility of people that are detained there. There's one detention facility I want to sort of think about because I've visited this facility. It's Stewart Detention Center in Lumpkin, Georgia, middle of nowhere, Georgia. It was designed as a maximum security prison. And what it does is it holds detainees who are awaiting deportation. Some of them have actually already gotten a final deportation order. And they're typically held there for years. And as they're held there, they are treated in, well, really questionable and inhumane ways. So the ACLU of Georgia recently, well, maybe not so recently, did this report that highlighted how detainees are regularly malnourished, sometimes receiving only one meal a day. And there are a number of questionable medical and hygiene practices there. So detainees are routinely denied medical care. And there are reports of some detainees, female detainees, being given soiled undergarments, resulting in infections that were left untreated. And as I think about then this existing standard level of care or treatment in a detention center, and then we add a infectious disease pandemic on top of that, I'm reminded of the fact that detainees, immigrants who are in detention centers, vulnerabilities are heightened by not only a communicable disease, but by the lack of political will to do something to better their treatment. And for me, this represents a couple of noteworthy points. We're dealing not only with a infectious disease pandemic, but we're also dealing with this rather serious political etiology of disease that also demands change. if I add one more thing to think about, I want to sort of highlight that if we look beyond detention centers and we think about COVID-19 and who's disproportionately affected, uh, some of the people who are disproportionately affected are most vulnerable because of their immigration status and how their immigration status and their labor intersect. So when we think about essential employees or essential workers, for example, I immediately think of farm workers, many of whom have a precarious documentation status, are unable to work from home, as I am doing at the moment, and are working in conditions that place them right next to or in large groups that therefore exacerbates their potential for exposure to COVID-19. Yet again, there's a lack of political will or interest to protect these populations.
Mhm. Yeah, and I think what I would add to that, right, is Nolan mentioned right away farm workers when thinking about essential workers, and I think about factory workers who are often a big population of immigrants, but especially in poultry plant workers, like in the South, we see undocumented folks working right alongside often Black women in that community. Um, and what was notable to me is I was doing this work where we were looking at the cases of the biggest super spreader events, right? So the Rose Garden now being a super spreader event, but super spreader events in our country, and also the places where the rates were climbing the highest. And the rates were climbing the highest. If you look at the top places, it was nursing homes, it was meat packing plants, and it was prisons, right? And when we look at meatpacking plants and prisons, as Nolan said, the goal of those places is to pack people of color as closely as we can be packed, to surveil them, or in the case of meatpacking plants, to increase the speed of the assembly line, right, or the disassembly line of meat carcasses, as it's called. But we started with this question of the history of policing, and when we bring in this incarceration and prison, and we look at the factories, we see that like largely the clustering of COVID-19 in communities of color is caused by a lot of these systems that were created, capitalist systems that were created to use our labor or to make money off of detaining us in small spaces, right? And this is one of the things that's really easy to miss when we're thinking, I'm getting distracted because you're snapping, and now I want to like stand up. If this was my classroom, I'd be standing up and walking around right now. But one of the things that we're able to miss when we look at these population rates, right, is we think of lots of individual Blacks, individual Latinos, individual white folks, and we forget that all of them, all of us, are parts of systems, and it's often those systems that are putting us in the situation that are highly infectious. The other intersection of the pandemic and policing, just that I'll bring up quickly, is this has also really shown us that the tools of state oppression, the state gets creative with their sharing of those tools, right? So we saw Border Patrol agents brought in to patrol DC. We saw Border Patrol drones patrolling protests in Milwaukee, for example, right? And then we see police often brought in collaborating with immigration enforcement. And one of the things that I think research should certainly work on is our conceptualization of Immigration and Customs Enforcement, ICE, enforcing in Latino communities, and police enforcing in Black communities. That's certainly not what happens. And I think the pandemic and the way it's been policed has shown us that.
Yeah, thank you. You guys have both done such a great job of situating us in our current crisis from history to now. And I guess what I want to move towards is the future. So if you guys could think of like any and all possible options, what do you think it would take to solve the current crisis? And what do you think are kind of the immediate and then the long-term solutions to making this crisis, to solving this crisis?
Can I start? I just spoke on a
Sure.
panel about this one actually, but one of the things that I think is both useful and illustrative, but also really frustrating about the pandemic, is it's showing all of this racial inequity that was already there, right? And now everybody's starting to care about it, and that's good, but it's also really frustrating. And I'll give you prison as an example. Actually, I'll start with, I'll share a story about one of my students who I mentioned earlier was profiled and arrested. And when he was arrested, it was right at the beginning of the pandemic, and he was detained in Monroe County Jail to be deported. And he was in this situation where we were trying to decide, should we work with a lawyer? You've been here for 2 decades, you have a partner, a job, etc. Or do you want to leave, right? And the rates were climbing, and he was trying to decide what to do. And, we looked at data, and there was more cases of COVID-19 deaths in US prisons than his entire country of birth, right? So ultimately, what he decided is like, I don't want to get infected and die in a prison. I guess I'm going to leave. And it was a heartbreaking situation because he was so trapped. Um, Among the many things I took away from this situation, besides just anger, was that folks are worried about this acute death to COVID in prison, right? So like, I'm worried about dying in prison in the next 6 months, year, as well they should be. Every year in prison is predicted to take 2 years off of your life expectancy, right? So we're worried about these acute and chronic acts of violence, or acute acts of violence, and we're missing the chronic acts of violence that slowly take away people from our lives, right? Prison system is bad. Whether you're going to die in 6 months or whether you're going to lose 10 years off of your life, it's bad for people, right? And this is just one of the many things that is highlighted by COVID-19. Oh, now I forget where I was. Oh, yes. So the point that I was going to make is that one of the things that we did when we realized that folks were dying in prison to COVID-19 was to rapidly decarcerate as much as we could, right? In some places. So what we did is we released folks who did not have serious offenses. We released folks who were in for fines, and you don't quote me on these because I'm not sure about the specifics of it, but point being, we reduced the jail population. So we can take lessons from this, right? We reduced the jail population and the world did not explode into crime, because this isn't actually what jail and prison do. They don't actually keep us safer. They just house a population of largely Black and brown bodies. Systems create profits off of this, but they're not keeping us safer. And the lessons we've used from how to decarcerate and how to reduce our prison population, we should certainly take with us after the pandemic. And the lessons that we as health folks have learned about how to talk about the constraints in the prison system, we should also take with us after the pandemic. Folks may stop dying of COVID after the pandemic, but the real pandemic is prison itself. We need to continue to illustrate that even later on, God willing, in the next few years.
Yeah. And just thinking about the ways in which these forms of inequality are situated within systems, right? Going back to that great point that you made. Part of me thinks, as we think about what are potential solutions to responding to the COVID-19 crisis and the concomitant racial injustice and inequality crisis, I think for me, then we need large scale systemic change. And then what does that look like? Well, in many ways, I think it looks like recognizing, as you point out, Bill, these sort of root causes or root shared systems of oppression that separate populations and divide them based on notions of racial difference or immigration status or other socially constructed notions of difference. So finding these places of common oppression and sharing in a struggle towards broader social and political justice is, I think, sort of the call on all of us. And for me, I think that starts to look like recognizing the necessity of breaking down boundaries, including boundaries of citizenship, and moving beyond a notion that citizenship somehow is the thing that guarantees you certain rights and entitlements to the state, because we perhaps don't need any of those kinds of ways to have recognition of our own humanity. So I think as we sort of start to plot a trajectory for a world where everyone's common humanity is recognized and shared beyond any kind of socially constructed notion of difference, I think then it takes a radical and sweeping recognition of what institutions are at work that perpetuate these kinds of inequalities, and then moving to dismantle them.
Yes, and we are going to have one more question before our Q&A session. So this is just to kind of give you the space to talk a little bit more about things that you're working on right now. I know you mentioned that you do have an article that's forthcoming in the near future, and you can talk a little bit more about that, or any other projects that you think people here would be very interested in. So.
Do you want to go first, Bill, or? Yeah, oh, okay. Well, so I have a couple of things that I'm working on at the moment that I think folks here might find interesting. And one that I want to highlight is, well, there are two. So I'm going to talk about two. So one is this project in Central Florida looking at how the Trump administration's anti-immigrant policies and politics have resulted in very specific lived experiences for undocumented Latinx immigrants living in Central Florida, many of whom are farm workers. And what I've been finding as a result of this collaborative qualitative research with farm worker organizations in the area is that recent xenophobic rhetoric from this administration has created what I've been calling clinical racism and mundane or routine racism. So clinical racism being this encounter of being denied care and because of the racist whims and impulses of someone in a clinic, and then feeling comfortable in expressing that because of the current political climate we find ourselves in, and this form of routine racism that I characterize as these expressions of xenophobia in mundane spaces like grocery stores, places of worship, again, precisely because of our current political climate. The other project looks at these emerging and recently formed LGBTQ+ Latinx organizations that formed after the Pulse shooting in Orlando in June 12th, 2016, which occurred on Latin Night. And in response to that shooting, a number of organizations have developed to advance a racial and gender justice, a broader social justice world that focuses on people at the intersection of having marginalized identities based on their sexual orientation and racial identities. And what I see is a really hopeful promise arriving out of these organizations' work is exactly this kind of suggestion that I was getting at, like this way of dismantling vehicles of social division based on notions of otherness, such as race, immigration status, sex, gender, sexual orientation, ability. And the cool thing is it seems to be happening here, where I am in Orlando.
Yeah, and I think it's great, Nolan, that you end with, your upcoming project is hopeful, right? I so often feel as though I'm talking about things that are not particularly hopeful. And I would characterize both of our books as fairly dark, right? So I went into it with the goal of diagnosing what I thought to be a serious social illness, which is immigration enforcement. And my current work, I didn't really want to do that. So like Nolan, I wanted to look at something brighter and more positive, or at least more empowering. And what we're looking at is, so we've returned to large-scale immigration raids, right? Work raids. And these are the type of raids that we saw in Postville, Iowa in 2008, for example. And then we stopped while Obama stopped, had different types of enforcement tactics, but left these large worksite raids. But Trump has returned to them. So what we've done is interviewed folks from the 6 large worksite raids that occurred in 2018. And these are the folks that responded to these raids, right? Because lots of what we've done is characterize the detrimental health impacts of immigration enforcement. But communities are creative and bold and inventive, and survive, right? And nonetheless thrive despite this kind of surveillance and violent enforcement. And so what we did is interview folks who have responded in these communities, many undocumented themselves, both Latinos and white folks, from different institutions. So we thought about the church, we thought about teachers, lawyers, faith-based institutions, I think I mentioned that, advocates. and just see how the communities came together after these worksite raids, with the hope that they don't happen again, but if they do, that we'll be able to respond as best we can. One of the interesting things about these raids, we interviewed folks throughout the Midwest. This is like the interior of the US, right? And they continued to describe them as natural disasters, right? So they paralleled them to floods and to just tornadoes, very country-ish feel. Um, heartland of the US is how we call it feel. But the thing about these disasters is the government often responds, and the government does not respond after immigration enforcement disasters because the government is actually the one doing it. So what happens is that we as communities have to figure out how to respond to these without any support from our government, as we have in the parallel situations of natural disasters. So we finished those interviews and we're writing up the results and looking forward to talking more and collaborating more with the multiple community partners we had when we did it.
Yeah, thank you so much for sharing. Those projects sound so very important and so critical for our moment. So we're going to transition now to the Q&A session and allow input from our audience members. So I have received some questions in the chat, and also if anyone wants to say their own question out loud, I just ask that you raise your hand so that we can do it in an orderly fashion, and then I'll tell you if you can unmute. So I'll start with the first question. This is in the chat, but how would you explain the connection between illegalization and racialization process of immigrants in a few sentences?
Who wants to go first? do you want me to give this a shot first, or do you want to go for it, Bill?
This is a tough question. Sure, you want me to go first? I can try that.
Sure.
Yeah. So one of our colleagues on who is also on this AJPH paper we keep referencing, Alana LeBron, actually did much of her work in Detroit, and what she talks about is these processes, these symbols of deportability, right? And Nolan and I both kind of mentioned these kind of things, but that slowly markers become associated with one's legal status. And as I mentioned, back in the history of policing, we saw this where skin color became associated with breaking the law, because for centuries it was, right? And it's a horrible fact of our country, but skin color became associated with breaking the law. And we see this among Latinos, that certain markers, and she calls them signs of deportability, become markers that one is undocumented, right? And so again, as I mentioned, things like the intersection of skin color, gender, and markers of being working class are the ones we see among Latinos, among undocumented folks. Nolan mentioned the white vans, which I hadn't seen, but it stands to reason, right? We don't have as much construction, we have more landscaping, landscaping and painting, and so those tend to be the signs here. But it's purely the, without the racial marker, that class marker isn't what's making ICE turn on their sirens, right? So it's a combination of those two things.
Yeah, and I think to add to that, the way that I sort of think of all of this working together is the process in which undocumented immigrants have become sort of this racialized other includes this criminality piece, right? So there's been this move in the United States to conflate unauthorized immigration with criminal racialized otherness. And the U.S. we have a deep history in the U.S. of racializing criminality, and I'm also reminded that historically, I think I mentioned this a bit earlier, right? That immigration law in the United States was so much about preserving whiteness that it very much included notions of who was considered appropriate to be allowed into the U.S. So if I'm trying to think of a nice succinct way, and I'm looking at the chat, I'm like, okay, just a few sentences, right?
Right.
So the key element here is the way that unauthorized immigration has become associated with criminality, and this notion of illegality has then become a synonym for racialized other, right? So people end up conflating these kinds of statuses. And it doesn't, we don't have to do much to see how that plays out in contemporary politics, particularly right now, right?
Yeah, and I'll add to that as we bring in the conversations about Latino folks and Black folks. This also happens in other communities. After 9/11, we certainly saw the racialization. We saw Arab, Muslim conflated with terrorists, right? So these are the labels thrust upon these communities to make them seem dangerous to justify the law enforcement that thus happens. I always joke that after there's a mass shooting, which is typically perpetrated by white men, I wonder if white men are more apt to get pulled over while they're driving or more apt to get stopped in the airports, right? It doesn't happen. The rhetoric that comes after is often, he's a lone wolf. And the irony on many of this is that after many of these school shootings, the response was, we need better mental health care. And the response when there was crime committed by any person of color of any of the groups I mentioned was quick criminalization of the entire group.
Yeah, that's a great point. Thank you for answering that question. Our second question from an audience member is, how has immigration policy and ICE enforcement affected the physical and mental health of children, either children who are undocumented or children who are those who are children of undocumented immigrants?
Yeah, I mean, I think that's a great question, and I'll share a story from my book. One of the individuals who was detained, he was just, so that they were looking for a very specific person who I call Santiago in the book, and he owned a taller, or an automobile workshop. And one of his customers came, and when his customer drove away, he was a Latino man. He got arrested. He was detained also, and he was detained for months before he was finally let out. And I remember his quote. He said, after I got out, the kids they continued to sleep in my bed for months, to sleep with me, because he said, if I'm holding your hand, no one can take you away from me, right? So his children were scared that every time he drove away was going to be the last time that they saw him, right? And it's not difficult to imagine what this does for you when you're dropped off at school and have to take a test, and you're worried that when your parent drives away might be the last time you see them. There's no way to exaggerate how serious of a repercussion this is for children, to know that not only is it possible that their parents would disappear, but their parents disappearing is the specific agenda of the US government, and enough people voted for someone with that specific agenda, right? So it's not only my parents may not pick me up, but this is what the country wants. So this has all kinds of implications for mental health and for just sense of belonging among children.
Yeah, and so those are such good points, and I'm reminded too of how there are such hidden consequences to family separation from deportation, and the ways that children and adolescents find themselves in caregiving roles that they didn't expect, or blame themselves, or have to change their own sort of plans for their own lives, right, and their educational goals and aspirations. And I'm actually thinking of a couple of different stories. So one thing I talk about in my book is how it was not uncommon for me to be doing interviews in people's homes, and people say something like, hey, see that, I'm reminded of one family in particular, see that table over there, that's full of documents, so that if our kids come home and see that we're not here, that they know who to call and where to go in case we're deported and never come back. And so indeed, right, this trauma, this daily trauma that we inflict upon people, they carry with them every day. And this certainly has lowered school educational performance, right? Because we have these moments where people are so anxious about their parents getting deported that they can't actually focus on school. But I'm also thinking about the ways in which this lingering sense of trauma and the acceptability, as you mentioned, Bill, this acceptability of this kind of state violence weighs on people. And I'm reminded that in this one interview that I did, someone explained to me, there's nowhere that's safe for me, and explained that it's not safe here in the US because this is a country where people don't want me and I don't belong. So as we think about how these policies and aggressive policing in general has consequences on entire families, I think we have to be attentive to the kinds of emotional burdens that we are placing on people and that we don't always talk about.
Yeah, thank you so much for contextualizing that and humanizing it, of course, which is always very, very important. We're going to have one last question from an audience member that is in the chat. So this person has been reading about Sikh men in one of their classes who have been initiating hunger strikes in ICE detention in protest of unfair treatment and abusive behavior. And their question is, do you know if these hunger strikes are common across other ICE facilities? And also, what do the results in the aftermath look like health-wise from such protests in detention centers?
I don't know if I can speak to the commonality of them, but I do want to sort of mention one consequence that I'm aware of from hunger strikes that occurred in detention centers in Georgia was retaliation, physical retaliation from guards and detention center managers. So in these detention centers that are run by private prison corporations that are meant to bring in a profit for shareholders, the leadership did not like negative attention drawn to their business, right? These are businesses. So what this ultimately translated to in some Georgia examples was physical abuse against those who were holding hunger strikes, and use of, totally blanked on the name. It's the independent isolation. What is that
Solitary.
called? Yes, thank you. Like, you know, that thing they talk about in Law and Order all the time or something, right? Like, yes, solitary confinement. Yeah, so strategic use of solitary confinement and meal rationing, denying of privileges and phone call rights. So I can't really speak to the commonality or what this looks like sort of on an individual physiological perspective, but thinking about the repercussions in this sort of interpersonal context, there are consequences.
Mm-hmm. Yeah, I agree. Broadly speaking, I know it happens. And I know with actually a few Google searches, you could find a good amount of data on hunger strikes, because I know they have happened specifically because of lack of protections during the COVID-19 pandemic as well. But one point that I think I'll highlight from what Nolan said is the use of solitary confinement to get people to eat again, right? So we know from our public health, and you know from your medical work, we stay healthy not only because of the medicines and food we put in our bodies, but because of the people we surround ourselves with. And what's notable is the isolation that can occur in prison, right? And so one of the outcomes of COVID-19 was decreasing staff, decreasing visitors, decreasing even phone calls. The Washtenaw County Sheriff's Office, for example, has their kiosk in which you call an inmate in their building. So they have less people calling inmates. And only thing that I want to highlight is this kind of isolation and severing of our social networks is terrible for people's health. So bad, it's even coercive enough to get people to eat, right? So it shows the trauma of both of these two methods of things that we know to be unhealthy for us.
Yeah, thank you so much. That concludes our Q&A session and of course the panel. I'm going to drop a flyer in the chat for everyone at this event that there's another event occurring this Friday hosted by Alpha Beta Beta, which is Yale's chapter of Sigma Delta Pi, and it's about activism among Spanish-speaking communities in the US. So I'll also put the registration link and everything so that anyone who's interested in attending can go. But aside from that, thank you so much, Dr. Lopez, and thank you, Dr. Kline, for sharing your knowledge and all of your insights with us. And thank you to all my fellow members of SHEA, particularly those who are in the workshop committee with me, for making this panel possible. It's been a pleasure to host this. I've learned so much, and I know everybody else has probably learned a lot too. So thank you to everyone for coming, and of course, thank you again for being part of this.
Yes, thank you, Alma. And before you go, can Nolan and I get a screenshot with you? We can
Yes.
circulate it on Twitter too. Great.
Yes.
And thank you all of the
Let's do
panelists
it.
for joining as well. And again, I sincerely apologize for my technical difficulties to start, but I appreciate your patience.